Hello, my name is Monahan. I'm a second-year medical student at OSU-CHS. I'm going over the paper Examination of Stigmatizing Language within Medical Literature on Psychosis. My co-authors on this project were Tanner Stone and Vinay Swami, both first-year medical students, and then our PI was Dr. Micah Hartwell. So for an introduction, psychosis refers to a set of symptoms frequently involving hallucinations, delusions, which may or may not include disorganized thoughts, speech, or behaviors. Conditions of psychosis, namely schizophrenia, have been subject to a lot of societal stigma. This can cause people who are experiencing early symptoms of psychosis or schizophrenia, say they're beginning to hear voices or beginning to have delusions that they think are not quite right, but they don't want to get help because they're worried that if they get a diagnosis, they're going to be labeled as crazy, psychotic, and they're not going to have the same sort of relationship with their peers or friends that they did prior to diagnosis. So this can cause them to delay treatment. It can worsen their prognosis. It's very important with these conditions to get on medications early. So delaying treatment can worsen the prognosis, and the kind of foundational idea behind this research is that adherence to person-centered language guidelines in published literature that physicians read, if they adhere to proper guidelines, then these physicians will use person-centered language with their patients, and then the patients with their communities use a less stigmatized viewpoint about these conditions. So the objectives were to explore person-centered language usage in articles focused on schizophrenia and other psychotic conditions, and to investigate if there were article characteristics which can be associated with varying usage of person-centered language guidelines. So here are the general methods. We used PubMed to search literature from 2020 to 2022, and we only included articles which had at least 20 articles about schizophrenia or psychosis, just to ensure that we're using the most relevant journals for this topic. And then we randomly selected 500 articles, then combed through those to make sure that they met inclusion criteria, of which 241 did. The inclusion criteria being that psychosis or schizophrenia were the main topics of these articles. And then in duplicate, we checked for each of these articles, just Control F for stigmatized language, which you'll see in the next slide, everything that we searched for. And then we noted the type of research, funding, institution, and so on. You can see here on the right is the full search term that we put into PubMed. Here are the first page of results. You see here the top line showing any stigmatized language is found in 53% of articles. Schizophrenia patient was the most common used label. About 35% of articles used at least one term of schizophrenia patient rather than patient with schizophrenia. A schizophrenic person or psychosis patient was the second most frequent, both at about 12.1%. You see down here the emotional language is saying they suffer from schizophrenia, suffer from hallucinations, and so on. About 9.6% of articles use that. And here it is broken down by type of article, type of research. You can see that of these 6 different types that we tracked, only the type of article and the type of intervention were found significant for varying rates of person-centered language adherence. The type of research, the article funding, then the employment of first and last authors did not seem to have a significant association with whether or not they adhered to person-centered language guidelines. So here is kind of our conclusions that we're drawing from this research. You see the majority of the medical articles that we screened did not adhere to PCL guidelines. When these articles that physicians or other patient-facing professions, they read these articles that include these stigmatized language, then they sort of internalize that, and then they use the same language to their patients who use the same language in their communities. And even if they're not outwardly stigmatized, they just perpetuate this sort of label first identity of like schizophrenic patient suffers from schizophrenia. So here on the right, just some suggestions of what to use instead. Just say to person with schizophrenia or they have schizophrenia, rather than to suggest that this diagnosis precludes them as a person or as a patient. And here are the references that we used. Right. And thank you very much for taking a few minutes to listen to my research.